Greetings, friends. Jacque Howard here, and welcome to Civic Engagement Radio Trenton 365. I encourage you, first of all, not only to just listen and enjoy the information that you're going to get, but take notes. And I encourage you to reach out to the organizations and the people that I bring onto the program, because again, the idea is that together, us coming together across the table, recognizing and respecting each other's differences is how we build a better community for everyone. So one of those people that I'm bringing on today is Emily Baggett. Emily Baggett is with the Trenton Health Team. Now, I know many people in the region have heard of the Trenton Health Team, especially after this past weekend with the cyclovia and the things that are happening in the East Trenton collaborative area that the Trenton Health Team is doing. But there's a lot more programming that takes place besides the art and the recreation and so forth. And Emily is going to let you know some more of the details of that. Emily is the Senior Director of Policy and Strategy for the Trenton Health Team. And she's going to come on now, and I'm going to have her introduce herself and share a bit more about the Trenton Health Team. Emily Baggett, thank you so much. It's so nice to finally see you in person as opposed to email and telephone calls. So welcome to Trenton 365 Civic Engagement Radio. Please introduce yourself, say a little bit about what you do with work, and then let's get right into talking about Trenton Health Team.
That sounds great. Thank you so much for having me on. My name is Emily Baggett, and I'm the Senior Director of Policy and Strategy at Trenton Health Team. And I am responsible for our policy and government affairs work, as well as leading our maternal health initiatives. And Trenton Health Team does a lot in Trenton and in Mercer County. We are at our heart a multi-sector convener and partnership organization with a mission to improve health and well-being in the Trenton region. So what does that actually mean? We do a lot of getting folks together to improve coordination across systems. We were actually started as an informal partnership between the major healthcare players in the city, Capital Health, St. Francis, Henry J. Austin, and the City of Trenton's Department of Health and Human Services. And over time grew to be a separate formal nonprofit. We're now up to over 40 employees. And we do everything from data work, connecting different doctors and hospitals, electronic medical records systems, to direct service on the ground with cancer screenings and community health worker interventions and nurse home visiting that we'll talk about later in the program. And we have a community advisory board. We have lots and lots of programs trying to improve health and well-being in the city of Trenton. And we take a very expansive definition of that. So things like sponsoring community events is part of that. And a huge thing we're working on right now is making sure that our city residents take advantage of getting the COVID vaccine as well. So that's been a big priority this year.
So Emily, you touched on so many things that the Trenton Health Team does, and I was fortunate enough to be a part of some early conversations here in the city with the Robert Wood Johnson Foundation of Healthy Kids and how that evolved into the Trenton Health Team and the different players. Trenton is a very interesting community when it comes to some of the challenges that the Trenton Health Team addresses. Not only are there physical things, but there's also language barriers, et cetera, because we have such a diverse population here. Can you talk about some of the work that Trenton Health Team is doing to make sure that the services that they offer reach out to different people and different communities and the languages that they speak?
Absolutely. Part of the challenge of operating in an environment such as Trenton is you have a lot of people getting healthcare through different programs and services. So not everyone is using private health insurance. Not everybody qualifies for Medicaid or Medicare. So what you have is kind of a mishmash of providers who will see the uninsured or who will take a sliding scale. You have different grant funded programs that are specifically for the uninsured, but then you can't necessarily serve, someone who's enrolled in Medicaid. And so it really takes a lot of coordination to improve the communication between these programs and communicate to patients and residents what services and supports they can take advantage of. We have mainly tried to ensure that a lot of our offerings are available in Spanish language for folks in the city. We just got census numbers, I think this week, showing the population growth among the Latinx community in Trenton. So our website is, you can click and have the website show up in Spanish. We have done a series of Facebook Live events where we'll do one day, we'll do the topic with English speaking guests, and then the next day we'll do the topic with Spanish speakers in Spanish. We have tried to do more radio ads, billboards, flyers. We've tried to make sure that our information is accessible to a Spanish speaking population in addition to an English speaking population. But challenges remain. There are many other languages spoken in our city, and barriers there.
And I love the fact that the way you presented it, it's just seamless. That's just what the organization does. It's not necessarily one or the other. And I say that because for the listening and viewing audience, I want them to know that this is a very tiny city, but a small town. Most of the people know each other. Many of the organizations partner with the other organizations and provide what the other organization can't, which is, to me, the definition of community. People in the body getting in together and doing what they can, working in conjunction, all with the idea that we're going to do this together. We're going to lift everyone together. And the Trenton Health Team has been doing that in lots of different ways. And again, for those of you who are just joining, Emily Baggett is the Senior Director of Policy and Strategy for the Trenton Health Team, which was born out of several organizations coming together, which were the healthcare facilities, St. Francis Hospital, Capital Health, Henry J. Alston, as well as the City of Trenton's Health Department. All those organizations came together and decided we're going to start this nonprofit organization and address some of these things with a hyper focus on Trentonians and the folks who are here, but partnering with outside agencies and organizations to make sure that all of that information and the services are getting to them. So Emily, I know that specifically one of the things that you are really excited about is this new initiative that Trenton Health Team has, and that is the maternal health initiative. Now, before we get into that, can you please give a disclaimer so that people don't get too excited and think, oh my God, I can call right now. I can jump into this right now. Can you just give a disclaimer about the maternal health initiative, where it is, some of the steps to take, what folks can expect, et cetera?
Absolutely. And great suggestion to lead with that. So we plan to launch this program in December of this year. We have been working on this for a long time, and this launch is a long time coming, but our plans are to launch in December. So if you or someone you know is pregnant and due in December or after December, and if they are a Mercer County resident, and if they will be delivering their newborn at Capital Health Hospital, then they will be offered a visit by a nurse as part of the Family Connects Mercer County pilot. So this is something Trenton Health Team's been working on. Like many of our programs, we do not do this alone. We are partnering with Central Jersey Family Health Consortium. They are hiring nurses now. So if you know any nurses that have perinatal or newborn nursing experience and they're interested in exploring home visiting, check out Central Jersey. They're still recruiting. And what this program will be is offering all families of newborns who are Mercer County residents and have their baby at Capital Health, they will be offered a comprehensive nurse home visit. Likely we will launch offering both in-home and telehealth visits, depending on the family's preference. But a nurse will, assuming you're comfortable, a nurse will come into your home and spend anywhere from 90 minutes to 2 hours with you and your family, and do a health assessment on the birth parent, do a health assessment on the newborn, assess how feeding is going, make sure everything that the family needs to be successful welcoming a newborn is in place. Some families may get 1 or 2 follow-up visits after that, but the majority of families will get that one fairly lengthy in-home visit when the newborn is about 3 weeks old. And then that nurse can help the family access other services that might be helpful. So things like, what are your childcare plans? If there's a plan to return to work, um, is there a need for diapers? Is there a need for some assistance getting healthy food in the home? Um, Things like that, as well as, are there any health issues of concern for either the birth parent or the newborn? Let's make sure get to the doctor to address those.
Now, when we talk about the physical well-being of mom and child, which is number one, we got to take care of that. But I know there's a lot of talk and concerns about the mental health and the mental capacity, especially with postpartum, et cetera. Will that be addressed as well?
Absolutely. The nurses will use a validated screening tool to assess for perinatal mood disorders. And my understanding of, and I should say, these Family Connect sites operate in other states. So there's, dozens of these in different communities around the country. So we are really fortunate to have a playbook as we launch this from Family Connects. My understanding too is, if there's anyone in the household where during the visit it comes up that the father has an issue of concern, or a grandparent living in the home, or maybe there's an older sibling who's having trouble adjusting to a new baby, or could be taking advantage of one of the preschool programs or something like that. It's intended to look at, certainly focus in on the birth parent and the newborn, but really, what does this family need to be successful in this vulnerable period? And that could include talking about services or referrals for anyone in the household.
So what it sounds like to me then is that along with the idea of the Trenton Health Team coming together in its formation of lots of different entities coming together, the programs and the services are similar with that. They mirror that, and that it may be named Maternal Health Initiative, but it's a much broader approach, and that the Trenton Health Team is not going to come into a situation and only do this, but not observe and assist or provide service for other needs.
That is absolutely accurate, and that is part of the Family Connects model. So that's not something that Trenton Health Team said, well, we have to go more expansive. That's sort of baked into this evidence-based model, is looking at the whole family, but it aligned very well with how Trenton Health Team approaches working with a patient or client.
All right, fantastic. Now, as we progress and move on, can you kind of just tell me a bit about what this is going to look like? Say, I am part of a household. We just had a newborn, birth parent is here. We've got a new child. First visit. Can you kind of walk us through what that process looks like?
Yeah. So hopefully, when the birth parent is pregnant and is in prenatal care, the providers are saying, there's going to be this service, it's going to be offered to you, and we recommend taking advantage of it, right? So our goal is that families are hearing about this when they're getting ready to welcome the newborn, and then in the hospital when they're on the recovery floor. So after the newborn is born and you're in kind of the postpartum recovery set area, someone who's employed by Trenton Health Team will be coming to the rooms of the Mercer County families and offering to sign them up for a visit. So they will, it's completely optional, but we're hoping many families will take advantage of this. And they will be offering families a visit, and then they'll assign that case to a nurse who will reach out to schedule the visit, which would happen roughly at 3 weeks, when the newborn's 3 weeks of age.
Okay, great. Now, there are always percentages of the population who are apprehensive for whatever reason, whether they're just unsure, they're uncomfortable, they're embarrassed, whatever those different things are. And folks, if that's you out there, please take advantage of what's available and let some of those fears and things that you may have, let those kind of dissipate. Let them go. Just know that you're in a safe space. Have some other adults around you if you're unsure, you're uncertain, but take advantage of these programs, because this is part of the funding that comes from the federal level, from the state level, from the county level, to help offset some of the situations that a lot of folks are in. So please take advantage of this. And if you have questions, if you're apprehensive, if you're nervous, you're scared, you're thinking someone else is going to come in and do something, ask some questions. Remember, you're in a hospital, you're in a safe space, etc. So, Emily, can you just address some of the concerns that some folks may have, who may be apprehensive, maybe concerned? I know we talk about the Latinx community, the Latinas, what immigration may be an issue, those types of things. Can you just address that a little bit?
Yes. One thing that is so important about the Family Connects program is that it is offered to everyone in a community, because bringing home a newborn is a vulnerable time for everyone. And in studies of Family Connect sites, they found that over 90% of families that get a visit have some sort of a need, whether that's for education or a referral to services or some kind of support. So this is a time when all families could use some extra support. And so part of the universal approach is to help reduce some of that stigma. And I don't mean to, people may have many barriers of why they're not comfortable having a nurse in their home. I can assure you that these nurses hired by Central Jersey will be culturally competent. They will be highly trained. They will, no one is going to notice if you're in a bathrobe or you're in your pajamas. Some sites, they even say to families, no need to do the dishes, no need to sweep the floor, no need to put on real clothes. You had a baby 3 weeks ago, it's okay. There may be other issues going on in the household. These nurses are willing to work with you if you need to go somewhere more private, if you need to go up into a bedroom or whatever to have the visit, we will work with you. I would hope everybody who, would be willing to take advantage of this visit. And we will do our best to serve families in the community.
Emily, I want to thank you and the organization, because there's a couple of things that you touched on in the last statement that I think are really critical. Oftentimes, like, we all get into these boxes, and this is my cat. He wants to say hi. Say hi, Tiger. You want to say hi to everybody? You want to say hi? Okay. So I think we get into these situations and spaces where we're so professional thinking that we kind of forget that we're dealing with human beings, and that all human beings aren't in the same space, and nor do we want all humans to be exactly the same. We want, some diversity, etc. So you touched on something that I like to say is, come as you are. Just be who you are. Don't worry about this or don't worry about those things. Let's take care of you as a human being first. And then all those other things just aren't so important. And I'm glad that you touched on that, because I'm sure there are a lot of folks in the listening and viewing audience who may feel, hey, someone is coming into my house. Is it clean? Is it dirty? Is it nice? I've got pets. I don't have pets, all those different things. And in actuality, our focus is on the well-being of the child bearer, the child, birther, all those things. That is where our focus is. I also want you to go back and touch on the actual timing of it. Because I mean, you said that it could be 90 minutes to an hour or 2 hours, 120 minutes. So during that time frame, I'm sure it's not like bang, 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 bang. It's not like a doctor's appointment. It's much more calming. Where are you, et cetera. Can you just take us through that and take us through that from the perspective of birth, parent, child, and also if there's any siblings or other folks in the house, what it would look like for them as well.
Yeah, so the nurse will come in, introduce himself or herself, meet the household members that are present for the visit, and ask how the family's doing. You know, this is not a 7-minute doctor's visit or a 17-minute doctor's visit. This is someone coming to your home to meet your family and see how you're doing. And yes, they have a massive list of things that they are going to be looking for as part of that conversation. They're assessing everything from, are your needs met in terms of household safety and food and, you know, things like that. They're doing things like blood pressure checks, weighing the newborn, you know, if there's like an incision site for a C-section, they may be looking at the incision site to make sure it's healing okay. So there's a lot that happens during this 2-hour visit, which is why they're there for 2 hours. You know, this is not, you know, I've had 2 children recently, and those 6-week postpartum health checks are pretty quick. Like, you doing okay? Let's take a look. All right, you're good. You know, you're on your way. Let's see how the baby's feeding. Let's see how you're doing bottles. There's a lot, which is why it's such a long visit. So the nurse is looking at, I think it's like 12 different domains for the family. But it's not, you're not sitting there with a checklist like you're answering the world's longest survey. It is going to feel comfortable for the families, as well as giving the nurse a really comprehensive picture of how this family is doing and what they may need.
Great. Well, I'm going to go back a second and say congratulations and kudos to you and yours on the birth of 2 new children. Is that what you just said?
Just in the past 5 years. My kids are
okay.
5.
Well, anyway,
so
you're a mommy and you
recent.
got 2. And you got 2. Hallelujah on that. So I'm glad that you went into a bit more detail because I think that like you personally said, you know, the postpartums, they're like, hey, how you doing? You look good. Great, great, great. Okay, next, get out. And this is not that. This is, how are you feeling? What are you eating? What do you need? Is the child healthy? How's the baby sleeping? Hey, how's your relationship with other folks here in the house? How are they adjusting to this new human being who's in the house? How's the new human being adjusting to them? And then I'm sure that there'll be conversations about how, if necessary, there needs to be some mental health checks or mental fitness checks in that as well. But I also like that you said, like, your life needs, like asking questions of the parents, the new parents. Do you need anything? You know, do you need help with some other services that the Trenton Health team can partner with some of the partnering organizations and get them there? I know one of the things that you mentioned was food. Oftentimes food is a challenging issue in urban environments. Well, you said that that's something that they're going to check. They're going to find out, hey, is there proper nutrition in the house for mom and for the newborn? And I'm sure that overlaps. I'm sure you're not going to dump a bunch of baby products and food just for mom. And if there's someone else in the house, they're not going to get any. It's going to be a whole focus. I want to go off into the weeds in just the next couple of minutes and just talk about some of the challenges with this. And I say that because many people ask, oh man, there's so many nonprofits. There's the same nonprofits doing the same exact work in Trenton and all these different things. And Trenton still has problems and urban communities still have problems. It seems like it's just a money pit. We're pouring all these money and services into this and it doesn't go anywhere. My belief is that all human beings should have access to the same exact basic things. And I think that we have the ability to do that. But from the standpoint of the Trenton Health Team and your position as the Senior Director of Policy and Strategy, Emily Baggett, can you just talk about some of the challenges that Trenton Health Team or this particular program, the Maternal Health Initiative, has, and what we can do to help eliminate some of those?
So there is always a tension between meeting immediate need versus looking deeper at some of the root causes. You can meet the immediate need of hunger and food insecurity and look at some of the root causes of what's going on, that we have too many families in poverty. We have too many families without access to well-paying jobs and secure jobs and or transportation to get to those jobs. At THT, we strive to address both, or work with our partners to ensure that the continuum is being addressed. Have we solved this problem? Absolutely not. The deep-rooted issues that are leading to things like food insecurity, housing insecurity, very high rates of chronic disease, those are really baked into dysfunctional systems, and they are not going to change overnight. So how do we, as a small nonprofit, help the system work better to both address urgent needs as well as do the coordination we can to improve the system? I don't have a great answer for how that's going to go. And we anticipate with Family Connects that there will be family needs where there is not capacity in the system to help everyone that needs safe, affordable housing, for example. That is one issue where we know the need and the demand exceeds the supply in the community. So there are issues where we know we're not going to be able to just make a referral and magically the family is going to get into safe housing that they can afford. Oh, I think you went on mute.
Well put, and I appreciate you for explaining it that way, because there is no one thing and everything's done and everything's fixed. And I think that hearing organizations be candid and be truthful about what it is, the work that they do and the outreach that they have, and recognizing that, hey, one organization's probably not going to be able to fix all of this, but collectively working together, working in partnership, figuring out how services can be cross-shared is how we can work towards affecting this and really making a big difference in the community to everyone without it being a competition or one organization thinking that, hey, because we've been doing it longer, our way is the best way. So I appreciate you for touching on that. I know that it's a difficult conversation to have for our nonprofit friends and family, but we need to have those conversations because we as a city, as a community, as a nation, need to get to this place where we're treating all humans equal. And that's pretty much it. I'd like to give you a minute to last pitch, soundbite to the folks about Trenton Health Team, about the maternal health initiative that's coming up in December, whatever it is you'd like. Just, you got a couple minutes here and just make a clear pitch.
Oh, thank you. Gosh. Please check out our website. You can learn more about our programs. We also are on social media. We're on Twitter, Facebook, Instagram, especially our Facebook page. We share our partners' events. We share educational materials. We have Facebook Live events where you can join live and chat in your questions to experts. Gosh, we have programs for, folks in the city with diabetes and education and support. So again, we have a lot of programs. I would bore you to tears if I sat and listed them all. But please do take advantage. If you're on Facebook or Instagram or Twitter, please go follow Trenton Health Team. We're easy to find. It's like at Trenton Health, and engage with us. Let us know what you'd like to see. Feel free to comment on our posts. Feel free to chat us questions on Facebook Live events and such, and check us out. And if you're pregnant and if you're due in December thereafter, we'll be coming to offer you a Family Connects visit, and I hope you'll take advantage of it.
Fantastic. Emily Baggett, Senior Director of Policy and Strategy for the Trenton Health Team. Thank you so much for your time today.
Thank you. It was great to be here.
You're so welcome. And there you have it, folks. Trenton 365 Civic Engagement with the Trenton Health Team, talking about their new initiative, the Maternal Health Initiative, which is starting in December. But do not wait. If you are interested, have a question. If you're pregnant now, planning on having your child in December, or you have a family member, please reach out to the Trenton Health Team. And I'll share that information on the website, jacque-howard.com. Until next time, folks, it's always about justice, peace, and humility.